Hi, Dr. Ballin. How are you?
Very good, and I trust that you're okay as
Doing
well.
well. Doing well. Glad to have you on. So, to my audience, welcome to the MMERI show. FAMU's MMERI show stands for Medical Marijuana Education and Research Initiative. My name is Cheryl Murray, and I'm your host for this episode. I'd like to introduce to you a good friend of mine, a mentor, a fellow soldier in the legalization strategy for cannabis internationally, Dr. Neville Ballin.
Pleased to meet you, and
Awesome.
thanks for asking me to join this meeting.
Fantastic. Well, Dr. Ballin, you have such a long history in medicine. I'd like to take us a little further back so I can learn more, our audience can learn more about your history. So my understanding is that you are a physician that first you were practicing in Europe, in the EU, and actually the UK. Can you talk about how you got into medicine and specifically how you got into being an anesthesiologist?
Well, just give you a short, just a brief history. I went to school, grew up in the UK, and it was just my parents told me that I always wanted to be a doctor. You never remember these things.
Right.
But anyway, we did our preliminaries, O levels and A levels in those times, and I went to Aberdeen University in Scotland.
Nice.
And that's where I graduated in my medical degree. While at Aberdeen, actually, we went through various specialties in our training. And anesthetics really, to me, was one of the best specialty. In fact, anesthetics and psychiatry were my two choices.
Nice.
But anesthesia, I loved it because one, I said to persons, it's medicine without clinics. And that was true until I started a pain clinic, because now it's just as bad. But seriously, though, anesthetics it allows your scientific mind, allow you to do your physics, electronics, and all the things along with working with patients. So that's why I did anesthesia.
Excellent.
So I did my postgraduate training in Britain, in various universities, in Leeds, Birmingham, where I got my fellowship, and then. After that, I decided to come back. I worked in Britain for a while and came back to the Caribbean.
Beautiful.
And I've
A lot of
been
people think anesthesiologists only work when it's time for surgery, but anesthesiologists tend to have a practice related to pain management overall, not just during surgery, but overall pain management. You want to talk about that?
Absolutely, because I know that in my first major hospital, the Leeds General Hospital, Leeds University Hospital Group. I started my pain management there because the pain management practice in Britain started with a gentleman called Frank Budd. Well, not started, he was very instrumental in setting up a lot of things in Britain. And he worked in our region. And so as a young doctor, we're exposed to all of that. I was also exposed to a lot of interventional pain by another consultant of mine, Dr. Ian Clark. I'll call those names because they were your mentors in terms of really, getting your mindset against these things, mind towards these things. So working with those guys, it really influenced me a lot in pain management. And then I went to the University of Birmingham at the Dudley Road Hospital in Birmingham with that group. Another mentor, a guy called Harry Desai, who started a pain management program in Birmingham at the hospital. So I worked with him right the way through my junior years and up until the fellowship. And nowadays, in terms of doing your fellowship, pain management is actually part of the anesthetic training and part of the fellowship exams.
That's great.
So,
very necessary.
Absolutely. So, I've been through the things to nowadays where we do your postgraduate training. Now, we have people now go and do postgraduate fellowships in pain, which I think the person in the States are well versed in that. And it's now occurring in Britain, where postgraduate, after you've done your fellowship and done your training, you then go into another year's training in pain management. So we're seeing a great evolution. And I want to thank my mentors in my early days who really inspired me to go on. So just a quick thing though, as a result of that, when I came back to Jamaica, one of my goals was to start a pain management clinic in Jamaica, which we've managed to do successfully. So I think that the message has been carried on, which is really what we really want to do. Our job is as a relay racer, so we're now passed on the baton to other persons coming through the system now.
Excellent. Well, thank you for your work. And, I've seen a few of your presentations, and you do a great job about talking about what is pain and how pain impacts. I can see the slide right now, how pain impacts all these different areas of your life, how it affects your quality of life from sleep and other areas. So can you talk a little bit about, one, the definition of pain, and how it can really impact, being in pain can impact the quality of life of a patient, and how cannabis is now being looked at as an option as far as relief for that pain?
Okay, that's a very broad and very good question to ask, really, because in fact, the International Association of Pain have got their definition, but one of the best definitions I've seen, which I have now adopted, is pain whatever the person says it is.
Right.
Because that, when all boils down to it, you have pain, and that's what you say it is. Now, the reason why I'll adopt that, which is really, to me, a synopsis of the International Association of Study of Pain, where we talk about pain may be real or perceived, which is that's clear, and where the different states, which is impacts. Now, reason why I like the definition of pain is what the person says it is, because we know that when a person, acute pain is clear. Something happens, you get the pain set off by the various chemical mediators from the injury, and then it stops as the situation heals. Now, when we speak about the chronic pain, the healing has occurred and you're left with pain. Now, how does it impact? One, people are saying, well, why do I have pain still? Because my bone is healed, the fracture is healed, the cut is healed, but I'm left with this pain. So we've got the psychological aspect of it. So we know now also that the chemical pathways are all impacted, because the same chemical pathways that sends for pain also affects your psychiatric aspect, there was serotonin and norepinephrine. So I think it's very important to understand that all these things are interlinked. Now, in terms of quality of life, I'm in pain, I can't look after my family.
Right.
That impacts you in other ways. Your finances go down, so you have financial issues. I cannot interact with socially. We're seeing now with COVID, so a lot of issues are coming out now because people are not interacting. So all of these things are there. So pain, it affects your physical thing.
Yeah, that's huge. I really loved your approach to looking at the holistic effects of pain and the need for pain management. How have you, when you had your practice in the UK, how did the profession look at incorporating medical marijuana at the time that you were practicing in the UK for pain management?
No, I can say not really, because it wasn't something that was ever really mentioned.
Okay.
Because in those days, remember, marijuana was a no-no. It was an illegal drug.
Right.
And
the devil's lettuce.
We've been locked up. Absolutely. So, and I have to say, as a black man in the UK, to say we want to go and push marijuana for a thing, right. I'll be in jail now.
Exactly. So it wasn't until you returned to Jamaica that you were able to incorporate medical marijuana, medical ganja, medical cannabis into your practice.
Right, and I think also it comes from the fact that I've always believed that there are more things to heal apart from going to your doctor.
Right.
And I always remember I was told that as a young medical student, when I was informed that only 60% of persons who get sick go to a doctor. Right. They get better. Or they do the home remedies. Now, since coming to the Caribbean, they realized there's so much bush around the place. And that's when they started to really look at things a different way as well.
Right.
And then marijuana was one of the bushes what people used extensively. So that was also used in that care of curing and health. And then you start looking at it now, you begin to realize there are a lot of features in it that is useful for care.
Right. Yeah, there's a lot of components, and in this series, I'm speaking to Dr. Henry Lowe as well as Dr. Grizzle about using cannabis for medicinal purposes. We're going to actually close out part 1, Dr. Neville Ballin,
Right.
and then we're going to come back for part 2. So thank you very much. In part 2, let's explore your practice, how you incorporate it, what your patients are telling you about self-medication versus having a more official approach to dosing cannabis.
Okay.
All right. So thank you for your time. We're going to close out. This is Cheryl Murray Powell, and you stay tuned in because we're going to have more with Dr. Neville Ballin.
Florida A&M University's Medical Marijuana Education and Research Initiative, or MMERI, wants you to know that we take your health seriously. That's why we bring you our neighborhood forums and our weekly MMERI Forum radio program. During this coronavirus outbreak, remember, wash your hands often, clean and disinfect frequently used objects, and stay home whenever possible. Please visit our website at meri.famu.edu for more information. MMERI, educating minorities about marijuana for medical use and the impact of the unlawful use of marijuana on minority communities.
Okay.
Hi, this is Cheryl Murray Powell. I'm back with Dr. Neville Ballin. He's a physician in Jamaica. He has a pain clinic, and he is going to explore and tell us a little bit more about how he uses medical cannabis in his practice to assist his patients. So, Dr. Ballin, we left off and you had touched upon the fact that when you moved your practice from the UK to Jamaica, you noticed that a lot of people were using indigenous plants and bush for their medicine. So let's talk about that practice of self-medication, that it's common in the Caribbean, but it's also common in the United States. So let's talk about the patient who self-medicates and how we transition them to a clinical environment.
No, I think, well, going back to what we had mentioned in the last segment, we said that most people who get ill, they will do their home remedies before going to a doctor. And probably here, because the access to care isn't as easy as it was in the UK, for instance, as a comparison. So people would stay and say, okay, let me try this and try that. And also, I think there's a strong history of what the historical, because all our grandmothers teach us things.
Right.
And your parents teach you things. And so people go back to that sort of issue. Well, what would I use? So you know that you can take some cerci for this. That's one of the bushes. You can make a poultice of banana leaves and use it for bringing down boils, which it does work. And so people do that before going to a doctor to get antibiotics.
Right.
And one thing I do notice that even it still stands today, Jamaican people generally, I find that they're not happy about taking medication, taking pills. So they will, most people seem to prefer, if I can do something without taking a pill, they'll be happy.
Right.
They will take it if you're convinced, but they prefer not to take the pills.
Right.
Exactly. I think that's why the bush therapy came out. And we know, for instance, that it came to a problem some years ago where there was an issue with people having the fibrosis of the liver after mixing the different bushes together. But luckily, the public education worked well, and so people realized and started to be more selective. So it's still there.
And the government tends to like more medicine-looking cannabis. So you have the consumer, the people who are like, I'm used to this bush medicine, my grandmother used it. And then in contrast, you have the government saying, listen, if it's medicine, it should look like medicine. So we like the tinctures, we like the capsules, but we're not so fond of maybe the actual plant. So that's a really interesting dynamic. So continue about self-medication.
Right. So I think where that came about, in fact, going right back up to the issue of the marijuana, is one of my patients was very much into it. And so, in fact, she probably taught me a lot about it because she would come in and bring in me samples of what she had made or she extracted at home using various methods of what she used for her chronic pain. Because she had a patient that had a very bad accident and was suffering quite a bit, multiple surgeries. And in fact, I realized that, okay, that's fine. So you're doing this one. And after us trying these things and using it, we managed to transition to some of the more formal things, because really some of the things she was using is not tested, so you're not sure exactly it works. And she had the side effects and that sort of thing. So we're trying to transition more to the more official, as it were, products. So I don't think it will stop though, because right now there are persons who are doing various things. In fact, I took just from me, my wife is a lady. She has some chronic pain issues, and somebody came to her the other day. And this is a mixture: green banana, apple cider vinegar, and honey mixture.
That's so Jamaican.
Right.
I love it. I love it.
Here's me now as a pain expert. My wife comes to me and says, "Look here, you're doing your rubbish. I'm going to take what's been given to me now, so of this mixture. Now, how much more can we take about self-medicating with natural stuff?" So what we have to do as physicians now, accept it, realize it's a reality, and start to incorporate it into our practice. That's what it's all about. Don't fight it.
Don't fight it. Just figure out how to incorporate and understand the dosing better, because the challenge that we have with indigenous plants and things that haven't been fallen into the category of traditional medicine is it affects every person differently. So with cannabis, we usually have start low, go slow, because we can't tell you exactly what's going to work for you or what's going to get you to the level of being too high. So physicians tend to say start low, go slow, and you'll find that sweet spot for you.
Right.
How do you approach that with your patients?
Well, absolutely that. First of all, I say to my patients, medical marijuana or marijuana is not a panacea. It works alongside all the other things what you have working with you, and we can get a better quality of life. So I approach from that side. I do not say to anybody that I'm going to give you this medication that's going to stop your pain. In fact, while you're there, I'm just going to read something to you. One of the patients, she's another very bad issue. I won't put her name. I started to try the marijuana rum, which is one of the compounds that we had used, on my localized pain and the muscle pain. It worked on that, but it didn't work so well with her nerve pain. I put her on a soluble, water-soluble preparation. I won't call the name.
Yeah.
And, it worked, but like she pointed out, that it works better when we have done some of the other modalities. So she gets the topical works great for her muscle pain. When we use the soluble along with other modalities, I give her intravenous infusion of ketamine and other things, she finds that she can function, get on with her life, and work better. So what we are seeing there is the synergistic effect of using some of the CBD compounds and also and using the other modalities. Right. I think that's where we approach it. I think if we continue to approach it that way, we'll see the benefit. But I've had some persons have said, "Look here, doctor, I've had excellent results and I've stopped all my medication. I just use alone." That's great. They're the good ones, because we see that wide scale. In terms of the effects and the side effects, yes, we have some patients who exhibit totally opposite effect. For instance, I'll give the same compound to someone. One sleeps and one stays awake.
Right.
And you wonder, what's going on there? So you're trying to look and see, are there anything else you're taking? Why should this have the two complete opposite effect?
Right.
When it does, I say, well, don't worry, let's stop it and find something else. So I think we have to approach this. We have to approach it in a very holistic and an open-minded way.
How do you respond to people who say that we don't know enough? There's not enough research for us to be using medical marijuana in a clinical setting.
Well, all I say to them, let's look at the proof of the pudding. I think that's how we started. We're looking at a plant which we have seen there are no known side effects. People have been looking for the side effects. And apart from the psychoactive side effect of the THC compounds and that in particular situations, I don't think we've really looked at the medical side and said, look, we're finding side effects. So therefore, if I can use it, incorporate it in your practice, and people can get a better outcome, that's really where we should be going. So I tell them, say, look here, if you can't get it from your doctor, I will treat you with it.
Right.
And it is very strange, because one thing we do know, we've seen good effects, is the problems with people having epilepsy. and it does work. And it gets live by some persons here, the neurologist, who will not incorporate it.
Right.
So that the patients come to me, so I give it to them, because I don't think it's ethical for me not to give you something which is helping you.
Right. So we discourage doctor shopping, but because your patients know that you are more open to holistic health and naturopathic methods, they'll come to you over another physician who's more hesitant or who hasn't opened up their mind to the fact that cannabis is actually medicine.
Right, right.
That's
I
interesting.
think
Yeah. So what do
I
you
like
think?
that point. Cannabis
Yeah.
is your medicine.
It is. It is.
Right.
And what do you think? What do you see in the future? We're in a COVID-19 situation currently. There's talk of cannabis being used as part of a COVID-19 medicine. What do you see beyond this period where the world has kind of stopped sudden as far as legalization of cannabis and more greater incorporation into the medical space?
Right. I see a great role for it, because I remember in the beginning we said that what's the role of cannabis in pain, and we speak about we didn't go through all the aspects of it, but one thing is the immune system. Right now we're talking about the immune boosting and the immune system. I think that, and I don't think there's any dispute on that just now. So I think as part of the overall management,
right,
I think it's going to play a great part. And I think the whole psychological aspect of it, because right now we're seeing the effects of people being locked down, and we're going to see more problems now,
right,
when with the issue of not finding work, things are stopping, family issues. And I think that we do know that the old medical marijuana, the CBD, in the different stages, do have an effect, a positive effect on that. So I think we should see some improvement we will see an incorporation of cannabis as part of the overall management of a lot of these patients, because not everyone we're going to be putting on these heavy duty antipsychotics, when we can utilize your CBD as part of the process.
And you've seen it helpful for getting your patients over opioid addiction, or even being more preventative of opioid addiction. You've seen that benefit of cannabis.
Absolutely, because one of the great things I've seen, some of the patients have had to stop the opioids completely, still continue with the cannabis, and they stop the use of opioids. So there's a very positive benefit on that side.
Awesome.
Very positive, very positive.
It sounds like the benefits outweigh the risk with your approach and with cannabis legalization. So thank you for sharing your experience as a physician, as an anesthesiologist, as a pain management expert. And you also lead an organization you're one of the leaders of an organization in Jamaica. They had a conference. When was that? Was that February or December?
I think it was November.
November. It's a long time ago.
Yeah, it's a long time.
Yeah, so tell us about the organization and how in educating physicians you've incorporated cannabis education.
Well, that's the Jamaica Pain Collaborative, we call it. And basically, so when we started the Pain Clinic, we had the idea to open it all up and try and invite people to involve them into the management of pain. So we formed the group, the Jamaica Pain Collaborative, which incorporates, anybody who's interested, pharmacists, physicians, any member of the public, and we get together so we can start to explore ideas and try to promote the issue of pain and the problems of someone with chronic pain. It's an important group because in terms of even understanding what pain is, and to get legislation sometimes to get medication, some of the medication that we want to get through in the government system, we can lobby as a collaborative rather than individual persons working together.
Fantastic.
So, it's not as successful as we'd like all your explosion organizations, but I think we're continuing to strive to improve it.
Awesome. Well, I just want to thank you for your work. Thank you for your friendship and all the insight that you've given us today. Look forward to working with you in the future and having you back on the show. Thank you, Dr. Neville Ballin.
Thank you very much.
You're very welcome. And that concludes this segment of the MMERI show, sponsored by Florida A&M University. That's MMERI, sponsored by Florida A&M University.